Hey, it's Chris Bowling.
Perspire.
TB
CB
Squared.
squared's back.
Hey, you've got a topic that you have spent a lot of time on.
Yes.
You really have raised the bar, having a deeper conversation outside of just claims.
Yes.
And I think it's fascinating.
So historically, when we would, especially self-funded, we would look at a self-funded plan and have actuaries figure out what is the cost of this plan going to be based on your census. What does it cost for care in this community versus that? And that's been helpful. As we talked last week, if you're hiring a bunch of employees from a certain area and boom, all of a sudden you get four new cancers, could you have even known that? You may know what the cost could be for that zip code, but we're starting to dive deeper into actual conditions based on where you live. And as we know, Iowa is the cancer capital of the US now.
Yep.
But as we start to look at our prospective clients and our clients taking a look at their census, we can not only understand what the prevalence of cancer is in those areas. Are they higher risk based on where they live? What's the prevalence of mental health conditions and access to care? And then starting to look at, based on zip code, what else do we see? Is there a higher arthritis? Is there a higher cardiovascular issue? It's not so much just what are we seeing in claims, but it's the risk factor of somebody living in that community.
Wow.
So it goes even deeper than that too. You see, somebody that has a higher chance of comorbidities with high blood pressure, type 2 diabetics, all of
Sure.
those things, and you say, okay, they're just an unhealthy population. But if you can tie that to the community to figure out, is that a community that rents are too high, access to food isn't there, people are dependent on government assistance for food, are they just unable to purchase the
Right.
types of food with the income they have to stay
Wow.
healthy? They could be involved in all your wellness programs that you have, but they can't access the things they need for basic
Right.
sustenance to be healthy.
Yeah. If they're running through Casey's for lunch and dinner,
Yeah.
a wellness program's not going to help that poor of a diet, you know?
No, no. And so we did this analysis for a prospective client as well. And it came back to, okay, we know that you've got a broad population. You are 78% female. And in that situation, here are the prevalence of these types of conditions on a census that's this much female and in these zip codes. So now we're talking about, what do we educate on? It
Got
isn't just a wellness program, but it's what program exists within your health plan that you can tie people into to get better care to address the things that are potentially going to hit them in the future.
Do you think it will help find the most appropriate targeted solution for certain areas? Because this prospective client has a population that's pretty spread out, right? So
Pretty spread out, multiple states.
did it did it give you any insight that maybe a broad-based wellness program wouldn't be as impactful as a point solution in these areas?
Yes, that was
Yeah.
really what I took from it is in this area where you're concentrated, you have access to healthcare, the income levels are good, but in some of your outlying areas, we're going to need a different education campaign and a different focus on what does it mean to stay healthy. And a lot of it comes back to get to your primary care physician because that's the one thing that's paid for by the plan.
Right.
But those members that are diagnosed with something are probably not taking their prescriptions regularly because of the income level, the cost of rent, and other priorities that are there. So you start to think about, if we're just going to give a broad based education on how to use your health plan, which we've done forever,
Right.
it needs to be more targeted based on your geography and what that member is going to experience in the future.
And were they fully insured or self-funded?
They are, yep, fully insured.
Fully
And so
insured.
this
So
was,
then we can't do uh waiving cost on medications if they fill them at this spot because we wanted to
yeah,
hit
not
the
currently, and that's the future opportunity. It's really now just, they've never looked at how to educate their membership really on anything, but
sure.
now really targeting, all right, let's talk about cancer prevention because we have a high risk of colon cancer in our zip codes. Let's talk about lung cancer because some of those communities are heavily hit with experience of lung cancer more than others. So, what screenings can we focus on as we educate? So, it was fascinating. We're starting to see more and more of this, both for prospective
Right.
clients and our clients to
You
do
got
deeper
all that
analysis.
and you got all that data, all that analysis done on a fully insured group that gives you limited data.
Yep. Yep.
Wow. That's freaking awesome.
Yep.
That's
Shout
exciting.
out to the team.
Shout out.
Yeah. So anyway, just a new way to look at risk. I think it's starting to evolve our way to consult.
Yeah, I love it. Well done, man.
Thank you.
Thank you for sharing.
Absolutely. Thanks, CB.
All right, we'll see you. Yep, bye-bye.